Hi everybody, I'm Sally Wilson and I have with me as my very special guest today, Dr. Petrina Barson. Welcome, Petrina.
Thank you, Sally.
Petrina, I'm very curious as to what you were doing before you came to TRTP and what led you to it.
Mm-hmm. Well, I'd been working as a general practitioner for many years and a GP with a special interest in mental health, and I was doing a lot of counselling based in cognitive and mindfulness methods, and aware for a long time actually that those methods were not effective in getting near or dealing with the underlying causes of my patients' distress. I was perhaps a slow learner, but it gradually dawned on me that really all these anxious and depressed patients who were sitting in the chair opposite me, underlying their depression and anxiety was trauma. And in a sense, those methods had nothing to say about that, no interventions to do anything about that. It was all about dealing with the effects of the trauma, the symptoms, if you like, relating differently to the thoughts or the emotions that came up. And that wasn't useless, but it wasn't, it wasn't useless, but it wasn't also highly effective, I felt. You know, we would make incremental progress up and down over the years. And so I'd been really looking for a long time for something that would actually deal safely with trauma. Done some trainings that I wasn't convinced was safe methods of dealing with trauma or highly reproducible methods. So I'd been looking, and then one of my patients who I sent off to see one of my usual stable of psychologists didn't see that psychologist and went to see somebody else. She'd been a very long-term depressed patient relating to a violent alcoholic father. She came back 1 month later and she said, "Petrina, I'm fixed. I'm not depressed anymore." And that had never happened to me before. So I said, "How? Why? What?" And she said, "Oh, I had this weird thing called the Richard's trauma process."
This weird thing.
Weird thing, yeah. She wasn't really able to describe it. She says it was really intense. It's kind of weird, but it was amazing. And so I rang the very experienced clinical psychologist that had delivered this process to her and said, "You know, what did you do to my patient?" And her description of this process really resonated with me. It made sense, and I was intrigued. So I sent about 8 of my patients off for it, and probably 6 of those at least came back with the most profound results I'd ever had. And so I was then very keen to do the training.
And so what were those results? I mean, you've told us about the first patient who went to this the psychologist, but what were the results of these other 6?
It's hard to remember now. It was a few years ago. It's hard to remember the specifics, but in general terms, you know, the effect was, you know, I'm well. You know, there was one in particular who actually initially didn't come back with that profound result, but she suffered from a very severe functional neurological disorder in that she was a young woman with no organic pathology in a wheelchair. She couldn't walk. She would be wheeled into my room by her poor mother, who was her full-time carer. And, you know, this young woman was very pathetic, really, meaning using the word kindly. She was very childlike and really totally dependent upon the care of her mother. And initially, after the Richard's trauma process, she only made an incremental step. Over subsequent months, she really got back on her feet and became, you know, a changed, visibly changed young woman. It was amazing.
Did she literally get back on her feet?
Literally got back on
literally.
Her feet. The last time I saw her, she was sporting a baseball cap in the corridor of my clinic and telling me how she and her mum were off on a trip around Australia.
Oh, isn't that wonderful? Gosh, and so since you've trained in the process yourself, how has it changed your practice?
Well, it's meant that when somebody that I have assessed as having a mental health problem needs counselling, needs, psychological intervention, it's generally the first thing I recommend, because I just, if people come to me for counselling these days and they don't want the Richard's trauma process, I get incredibly impatient, because I say to them sometimes, well, we can do this, we can keep on counselling you, or we can fix this. And so generally I'm a sort of a keen advocate of them doing the Richard's trauma process. And so that's the most obvious way that really the counselling that I do largely is the Richard's trauma process, because it's just orders of magnitude more effective than anything else. But also it's actually changed the way, to some extent, I work as a GP. Even when I'm treating, normal general practice stuff, I think I'm more effective at, I've always been an empathic person, but I think I'm more effective at creating a bubble of trust, a sort of being there with my patient and kind of holding them, having a sort of a sense that, helping them have a sense that they are safe in my hands. And at being perhaps a bit more assertive, in terms of, kind of not holding back sometimes from saying my truth as I see it in terms of their presentation. So just yesterday I confronted a gentleman about the way he was treating his wife, and I spoke in very plain language, about that. And I think that partly comes from just a sense of greater confidence and ease in terms of being sort of it's an interesting combination, because I'm not paternalistic. I don't like to tell people what to do, but nevertheless having more authority in terms of dealing with their health and perhaps stepping into that authority a bit more.
Yeah. And I'm just curious, when you trained in the Richard's trauma process and started implementing it in your practice with your patients, did you get any pushback from your fellow medical professionals? What were the reactions or responses to your doing this work?
On the whole, there was interest and curiosity. Of course, there's skepticism. That's only natural. I was skeptical too. I took, although I said I was kind of eager to learn and eager to enroll, I was no easy convert. I kind of sat there with my arms folded for a while. And so, of course, there's skepticism, and I just think that's only natural. You have to see the results for yourself. And, I never say that it's 100% effective. Of course not. There are my patients who I am still working with. I've done the Richard's trauma process with them, and I'm still slogging away with them with other methods. That's certainly true. It's not 100% effective, but it is, I believe, orders of magnitude more effective than other methods, because it does the right thing in relation to trauma. So my colleagues send me patients, and when they see them come back well, that's when it's your patient and you've sent them off for the Richard's trauma process and they come back transformed, that's a very profound experience. That's a very compelling experience. So I do get referrals from my colleagues inside the practice, but most of my referrals these days come from friends or family members of people who've done the process with me.
Yeah. Petrina, thank you so much for joining me today and for sharing your experience and your insights. So valuable and so appreciated. So thank you very much.
Thank you, Sally. Thank you.
And thank you, everybody, for listening and for tuning in and being part of this conversation. Thank you. Bye.
Bye.